Okay, so this is Ashley Cohn. Here is the room where I'm doing my examination. Excuse me. Okay, yeah. Okay, well, I can see you mostly, so. Okay, hello. My name is Ashley, and I'm a nurse practitioner student, and I'll be doing your examination today. It's nice to meet you.
Hi, Ashley. It's nice to meet you too.
Okay, do you have any questions or concerns for us that you want me to take care of today while you're here?
No.
Okay, great. So we have a 32-year-old female in apparent good health. She's here for a normal checkup. She does not have any complaints or concerns at the moment. She appears to be alert and oriented and able to provide a reliable history as well as answer appropriate questions. On general survey, we see that her skin is an appropriate color for her ethnicity. She has no signs of pallor, cyanosis, no jaundice, no skin lesions to note. Fingernails appear to be the correct color for her ethnicity. And I'll just check her capillary refill by squeezing a finger on each hand. Okay, and then doing the same on the toes. Okay. All right, great. So we see normal capillary refill less than 3 seconds in all extremities. So we'll move on to her head. Do you have any issues with your head lately that you've noticed in your scalp or hair or anything like that?
No.
Okay, great. So first I'm going to feel your skull. It feels normal shapes, no problems at the suture lines. The hair looks healthy, it looks clean, good hygiene practices. The scalp looks clean and healthy also. The hair is normal texture and thickness. All right, great. All right, looking at her face, it's symmetrical, no facial drooping. There's no signs of normal hair growth, no lesions. Her eyes, inspecting her eyes shows that the sclera is white, the conjunctiva is pink bilaterally. Do you have any problems with your eyes that you want us to address today?
No.
Okay, great. So first we'll take a look at your eyes. The first thing I'm going to do is just quickly shine a little light so that I can see your pupil reaction. So if you'll just look straight ahead for me. Okay, just look straight ahead. I'm just gonna, okay. All right, great. And I'm gonna turn the light off, and if you can just stare straight at this for a second, right here in the middle. All right. Okay, great. So the eye exam shows that the pupils are round, they're reactive, they're equal, they're reactive to light and accommodation. They go from about 5 millimeters to 4 millimeters with light. And then we'll just do another exam that's going to get a little bit closer. So I'm going to start on this. I'm going to just place my hand right here just to give it a little steady. Okay, and I'm going to move closer and closer and closer. Okay. And I'm going to have you turn just a little bit just so they can, my arm's not in the way. All right, we're going to do the same thing on this side. We're going to start out here. I'm going to move closer, closer. All right, great. Looks good. Looks sharp and no sharp edges, no signs of nystagmus or hemorrhage or arterial or narrowing. The eyebrows and lashes look normal. And then we're just going to do one test to test the muscles in your eyes. So if you'll just follow my finger with your eyes, but not your head. All right, perfect. So your extraocular eye muscles, eye movements are normal. And so we'll move on. Let's see, I'm gonna just check your sinuses really quick. Just let me know if there's any tenderness when I put a little pressure. How about here?
Nope.
Okay, and how about here?
Nope.
All right, great, no sinus tenderness. So we'll move on to your ears. Okay, so first I'm just gonna feel them, feel the outside auricles and your tragus, okay? And then on this side, okay, no abnormalities, no drainage, everything looks good, no lesions. We'll just take a quick look inside. You can just hold your head still. I'm gonna lift up and looks good. I'm gonna come over to this side. Okay. Great. All right. So the tympanic membrane is intact and mobile bilaterally. No erythema, no redness, no swelling, no drainage bilaterally. So we're gonna do. Do you feel like you have any problems with hearing?
No.
Okay, good. We're gonna do a couple of hearing tests. So first is gonna just test your gross hearing. I'm gonna stand a couple of feet behind you on each side, and I'm going to whisper 3 words. So you just repeat the words that you hear.
Red. Orange. Yellow.
All right, great. Hope you can't see me. Okay, this is weird. Okay, now the other side. Blue.
Blue. Purple. Green.
All right, great. Okay, let's move this back just a little bit. Okay, and now we're going to use these tuning forks. The first test, I'm going to hit it on the table, I'm going to activate it, and then I'm going to set it on top of your head. And you're going to tell me where you hear it. Do you hear it on the right side? Do you hear it on the left side? Or do you hear it in the middle? Okay?
Middle.
All right, great. So it's heard midline. In the second test, what I'm going to do is I'm going to activate it again. I'm going to set it on the bone right behind your ear. And when you can no longer hear the noise, let me know, and I'll quickly move it in front of your ear, and you let me know if you can hear it there.
Okay. I can't hear it anymore. I can hear it.
Okay, perfect. Let me see if I can go around behind her. Okay, look that way a little bit for me. Okay, ready?
I can't hear it anymore. I can hear it.
Okay, perfect. So bilaterally, the air conduction is greater than the bone conduction, which is a normal finding. Did I do your nose?
Mm-hmm.
Okay, so we're going to move on to your nose. Initial inspection shows it's symmetrical, no redness, no swelling. We're just going to take a light. We're going to just look in real quick. Okay, all right, looks good. Septum's midline, mucosa is pink and moist. So do you have any problems with smelling or your nose that you're concerned about? Okay, great. So we'll move on to your mouth. Okay, so I can see that your lips are pink and moist. You can open up for me. Open up. Okay, and then stick your tongue out and say ah.
Ah.
All right, so the palate, appropriate normal movement for the palate and uvula. The tonsils are present. They are pink and moist, as well as the pharynx. No signs of exudates or drainage. And the tongue is midline. The teeth and gums look good. They appear to be well maintained with good hygiene. Yeah. Okay, and one more thing on your face. We're gonna, if you can just open and close your mouth for me. All right, now close. All right, the TMJ is intact. It is normal, no popping or clicking with opening a mouth. Okay, so now we're gonna move on to your neck. Neck is supple, and I'm just gonna feel right here. The trachea is midline. Can you swallow for me? All right, great. The thyroid is palpable, but the lobes are not felt. Have you had any symptoms such as being really hot all the time, really cold all the time, or really tired or really energetic out of the normal for you?
No.
Okay, great. Those can be signs of thyroid disorders. So even though your thyroid feels great, we just want to ask those questions. If you experience symptoms like that, you let us know, okay? So the final thing I'm going to do is check your lymph nodes. We got 10 sets, so we're going to start back here. These are your occipital nodes. We'll move to your post-auricular nodes, and then in front to your pre-auricular nodes. We're going to move down to your tonsillar nodes, and then your submandible nodes, and then your submental nodes. We'll feel your superficial posterior cervical nodes. This is the superficial anterior. And then to feel the deep cervical nodes, if you'll turn one way to one side for me. All right, and I'm gonna feel them here. Okay, now if you'll turn the other way. And this is how we can feel the deep cervical nodes. And then finally, we'll do the subclavicular, supraclavicular nodes. Okay, great. Do you have any questions or concerns that we haven't addressed yet?
No.
Okay, great. Well, I really appreciate your time. It's been a pleasure, and I look forward to seeing you next time.
Thank you, Ashley.